What is Medicare? Who is eligible for it and how does it work? Medicare is health insurance provided by the U.S. government for people over 65 or for some disabled persons. Medicare is made up of four parts: Part A, Part B, Part C, and you guessed it, Part D. Let's talk about what the letters really mean. Parts A and B are what is known as Original Medicare, which most people are eligible for when they turn 65. Part A is automatic. Parts B, C, and D, on the other hand, are optional. Original Medicare Parts A and B and Medicare Supplement don't cover prescription drugs. That's where Medicare Part D comes in. Medicare Part D is offered by insurance companies like Blue Cross and Blue Shield of Kansas, and it helps pay for prescription drugs. Each prescription drug plan has a list of generic and brand name drugs that are covered by that plan, called a formulary. Each drug is assigned to a tier, which determines how much you will pay for that drug. You can get Part D either as a standalone plan or as part of a Medicare Advantage plan. It's up to you and your needs. Here's how Medicare Part D works. You can sign up for Part D when you first become eligible for Medicare. Part D is optional, but if you do not enroll in a Part D plan when you first become eligible, there may be a late enrollment penalty. The late enrollment penalty is calculated by multiplying 1% of the national base beneficiary premium times the number of months you went without other credible prescription drug coverage. By enrolling in Medicare Part D when you become eligible, you can save money on prescription drugs, better manage your healthcare budget, and have prescription drug coverage in place should your health needs change in the future. Prescription drug coverage can be broken into four stages: deductible, initial coverage, coverage gap, and catastrophic coverage. The deductible is the amount you must pay each year for your prescriptions before your Medicare prescription drug plan begins to pay its share of your covered drugs. Some Medicare Advantage and prescription drug plans can have a $0 deductible, so coverage begins with the first dollar you're charged for prescriptions. Once you enter the initial coverage, you pay a copayment or coinsurance for your covered prescriptions, and your plan pays its share for covered drugs until the combined amount reaches the yearly limit. Here's an example. Let's say a 30-day supply of a preferred generic prescription drug costs $100. With Part D plans, you would pay a copay, for example, $5, and your plan would pay the remainder of the cost, in this example, $95. However, the total drug cost of $100 is the amount that would count towards the initial coverage limit. Most Medicare drug plans have a coverage gap, also called the donut hole. The coverage gap begins after you and your drug plan together have spent a certain amount for covered drugs. Once you enter the coverage gap, you pay a percentage of the plan's cost for covered brand name drugs, and a percentage of the remainder of the plan's cost for covered generic drugs, until you reach the end of the coverage gap. Not everyone will enter the coverage gap because their drug costs won't be high enough. Once you get out of the coverage gap, you automatically move into the catastrophic coverage period. With catastrophic coverage, you only pay a small coinsurance amount or copayment for covered drugs for the rest of the year. Hopefully that gives you a basic understanding of Medicare Part D and how it works, and you're on the road to choosing the right plan for your healthcare needs. Have questions? Give our Medicare advisors a call at 866-627-6705.